This conference will now be recorded.
Excellent. Oh, Lisa Ma Roy took her test and she passed. That is so exciting. Wow, that's amazing. Lisa Ma, do you have any words of encouragement for our friend Allison? Anything you want to tell her?
Yeah, thank you, Luz. Your sections and the podcast, everything helped me a lot. I was like reviewing a podcast, the YouTube videos. That really helped me to look at the question, how to eliminate the questions, answer choices. And there were a lot of questions I got from sterilization, endoscopy, construction, mainly related different questions, aspergillosis,
Okay.
and vaccines for the employee health. That is mainly the serology. I had
Mm-hmm.
questions on varicella, MMR. They were like, there is no evidence of immunity. How often give the vaccinations? Those were the questions, not like a serology.
Uh-huh.
They were asking like how often you give the vaccination, something like that.
Okay.
And there were one question like infant after 1 week after birth had sepsis. What is the concern of organism? They asked step A, step B, step C, steps B. Those are the choices Then there were questions on like health in a daycare center and healthcare facility, the screening for the daycare employees. What type of screening? There were scenarios and they asking like what type of screening you do for those employees. And some questions on pertussis. What is the appropriate specimen to collect for the pertussis?
Yeah, so lots of stuff on
Yeah.
lots of different diseases.
Surgical site infections. I was listening to a last week class and there was question on ventilator associated pneumonia. The exact question they asked the thorax
Oh,
ventilator or yeah.
so that one came right on time. Okay. Well, thank you so much.
Yeah.
Appreciate your input. All right, guys, so today's is going to be a little bit of a different one. We have not covered this together as a group before. We're going to do waste management. So let's go over some IP updates, our plan, and then waste management with some questions. Okay, so some updates that I want you guys to be aware of. APIC is going to be having a cleaning, disinfection, and sterilization conference in Boston from November 10th to the 11th. Today is their last day for you to submit a proposal for a 60-minute session. So if you didn't know about it till today, well, it's kind of late, but just wanted to let you know that this is education that's coming up. They also have some, this is all APIC, they have some additional events. So these upcoming events are obviously stuff you have to pay for. This virtual ambulatory and outpatient surgical services one is pretty pricey, but they also have some upcoming webinars that they're going to be doing on the 11th, the 13th, the 28th, and on August 3rd, so that everyone's kind of aware. This is the virtual ambulatory and outpatient surgical services training. As you can see, it is quite pricey, about $1,400, but if this is an area of focus or if this is one of the areas that you're assigned to, just be curious, ask. It's coming up quick, so it may be too late, but to ask your leadership for support. But you never know. It is virtual, so that's good. And then here's the OR Excellence of 2020, which is presented by Outpatient Surgery Magazine and AORN, mostly focusing on outpatient ambulatory surgery centers. That's going to be held in Orlando for some of our Florida people, if this is an option for you. Okay, another thing, if you haven't taken a look at the the prevention strategists, celebrating APIC's 50 years, I highly recommend it. It was just, they had such great articles on there. They had such great information. There was one that was written by a doctor of physical therapy who's also an IP. And I'm like, oh my gosh, it's just so exciting to see all of these different specialties and areas coming into infection prevention and making a difference in our patients' lives. They had another spread focusing on mentors and mentee relationships. It was really well put together. So highly recommending it for those of you who haven't had a chance to see it. So week 11, so we're down here, week 11, and we're going over Waste management. So last year, we did pharmacy services, and it was a pretty thorough presentation. So I was like, you know what? I'm not going to do pharmacy services again. You guys have this available on YouTube. You can go back and watch it so that you can make sure you get your full hour and 3 minutes of pharmacy services. And today we're going to be covering waste management. This chapter was recently updated. It was updated on March 18th of 2022 by Dr. William Pate, and he is really intense. Just look at he just doctorate in public health, MBA. He's got all of these certified safety professional, hazardous management stuff. Like, just you can tell this man is knowledgeable about waste management. And so I thought it was important for us to cover it, especially since there was such a recent update, March 18th of 2022. That was just a couple months ago. So just this is going to be more of we're going to be reading, understanding the information, kind of taking it all in, and hopefully this will help you for some of the content that might be on your test. Okay, so waste management. Definitions of medical waste can be confusing. These are some of our key concepts. Medical waste regulations and guidance should be based on scientific analysis. Waste management plans should include input from the Infection Prevention and Control Program, and the infection preventionists should be aware of new technology and emerging issues related to regulated medical waste. A properly managed medical waste management program reduces regulatory risk, increases staff, patient, and public safety, and provides cost savings to their institution. Because one of the things that they make sure you understand is just how pricey and expensive it is to get rid of infectious waste. Performance improvement may be used to measure effectiveness of waste management, and internationally, the personnel responsible for managing healthcare waste can vary considerably based on country-specific regulatory requirements and definitions. So waste management, basic principles. These are some of our basic principles for waste management. Terms such as biomedical waste, regulated waste, red bag waste, medical waste, and infectious waste have been used interchangeably. The same term may have a different definition depending on the resource. The WHO defined infectious waste as waste suspected to contain pathogens and that poses a risk of disease transmission. OSHA, Bloodborne Pathogen Standard, uses the term regulated waste, which is defined as liquid or semi-liquid blood or other potentially infectious materials. In the chapter, they're going to use the term infectious waste, and the definition for that is going to be waste that is capable of producing an infectious disease. Okay, so again, lots of different definitions. You know, one of the things that I found really interesting about this chapter was all of the different sources of information, because it's so similar to so many of our other areas, right? We have, like, for example, for cleaning, disinfection, and sterilization, yes, we have our APIC text, but we have CDC guidelines. We have AMI, we have AORN. There's like all of these different parties that are involved in us really thoroughly understanding that specific area and topic. And let me tell you something, waste management is serious. Okay, it is serious stuff. I spent some time with our safety specialist, just learning a little bit about waste, because let me tell you something, I was asking questions. Okay, I've been trying to really understand waste management better, specifically at my facility while reading this, because I feel like that's how information really sticks. Is okay, yeah, Luce is telling you this is what waste management is, but do you know how waste management is handled at your facility? Do you know who you would call if you potentially had an Ebola patient in your emergency department? Do you know who you could call, who might be able to help you to ensure that waste management is happening appropriately? Because they want us to be knowledgeable on all of this, but let me tell you something. The amount of information, just their reference textbooks in general, are insane. They have categories for all different types of waste. They have it's numerical and by letter. So it's like you have F categories, D categories, S. It's bananas. It's really intense. Um, okay, let me bring it back. Let me bring it back. Okay, so for a waste to be capable of causing infection, all 5 of the following specific factors are necessary. So 1, we need a dose. 2, we need host susceptibility. 3, we need the presence of a pathogen. 4, virulence of a pathogen. And 5 is going to be a portal of entry. All right, so let's do some types of infectious waste. So I'm going to read the example, and then you can type in the chat what you think it is. Some of these are going to be really easy, so just give it a try. So the first one is going to be tissue samples or organs collected during autopsy, tissue specimens collected or removed as a result of surgery. What does that sound like? Okay, that is going to be pathology waste. Okay, the next one, whole blood, serum, red blood cells, albumin, blood coagulation factors, and immunoglobulins. This one's pretty straightforward, so I won't make you guess. It's going to be blood and blood products. All right, next one. Discarded needles, scalpels, broken glass, slides, and Pasteur pipettes. Good job, Caitlin. She said sharps. Very good. Contaminated sharps. All right, the next one is going to be bacterial and viral stocks used in research, cultures of infectious bacteria. Who probably has this in our facilities? The lab, yes. Very good. Microbiological cultures and stocks of infectious agents. Tissue or blood from research animals infected with infectious agents. That's going to be animal waste. And then the very last one is hemorrhagic fever, viruses, Ebola, hantavirus, and smallpox, which is going to be our category A infectious waste. So try to remember all of these different infectious waste categories. We have pathology, blood and blood products, contaminated sharps, microbiological cultures, and stocks of infectious agents, animal waste, and category A infectious waste. So now we're going to talk about the disposal and management of those different types of waste. So we're going to use chemical, thermal, like an autoclave, or radiological irradiation treatment inactivation prior to the disposal as a non-hazardous waste. You ship off-site as regulated medical waste for final disposal if on-site treatment is not possible. Which one do you think that is? We're a little shy today. That's okay. Microbiological cultures and stocks of infectious agents. Okay, the next one, evaluate for potential zoonotic exposure risk and treat on site prior to disposal. Very good. It's going to be animal waste. The next one is blood saturated materials and bulk liquids are to be collected as regulated medical waste. Use chemical, bleach, or thermal treatment on site. Bulk blood should be solidified if being transported on or off site. That one's pretty straightforward. It's going to be our blood and blood products. Next one, use on-site inactivation, autoclave, or incineration whenever possible. Off-site treatment requires shipment as a Category A infectious substance and compliance with Department of Transportation requirements. The answer is in the description. Category A infectious waste. All right, place in an appropriate, rigid, puncture-resistant, closable, and leak-proof container for immediate disposal. Contaminated sharps, very good. And then the very last one, formalin fixation reduces infectious hazard immensely. Incineration or grinding for sanitary sewer discharge is usually acceptable. Avoid the release of recognizable human body parts into landfill waste streams. That's going to be pathology waste. All right, so let's go over our contaminated sharps. So all discarded sharps like needles, scalpels, and items that could potentially become sharps like glass pasture pipettes or glass slides should be considered and treated as potentially infectious waste due to their potential to cause cuts or puncture wounds. This category of infectious waste poses the greatest risk for injuries. Okay, so this is where you're going to have your most injuries with your sharps. The risk of infection is related to contamination with a sufficient dose of pathogenic organisms like Hep B, Hep C, or HIV, and the provision of a portal of entry into a susceptible host via a puncture or cut. These devices represent a significant occupational hazard to those handling and disposing of them. However, once contaminated sharps are properly placed into appropriate rigid puncture-resistant containers, the environmental risk that they pose is negligible. So, I mean, definitely this is one of the things that you keep an eye out for when you're doing your environment of care rounds. You're looking at your fill lines. You're trying to get an idea of how your sharps are doing and what's going on. And then, so another thing to be familiar with is who's responsible. So who's responsible for ensuring that those waste containers are being emptied or changed and disposed of appropriately. So for us, we have a company that comes on site and does all of that for the campus. Um, so that's another thing to ask around and find out how it's done. Microbiologic cultures and stocks of infectious agents. So of all the possible categories of infectious waste, cultures, stocks, and amplified microbial populations that have not undergone predisposed treatment like autoclaving or bleach treatments pose the greatest potential for infectious disease transmission because they contain high concentrations of potentially pathogenic organisms. And this is really important because how often are you going into your micro lab, or how often are you visiting your lab? Right? How often are you going to your lab, doing an audit there, seeing how team members are handling some of this stuff? I mean, this is definitely an important portion of infection prevention. And most recently, like I've been trying to. Okay, so the thing is, it's hard to have all of these like ongoing and close relationships with different departments, just because of time and staffing, right? But I try to make sure that we as a team are expanding and trying to improve on those relationships. So this is one that I definitely want to work on, which is having better relationship with the lab. Laboratory personnel should handle discarded cultures and stocks accordingly. Cultures and stocks may be stored in glass containers or tubes that, if broken, become contaminated sharps and therefore should be handled carefully. Microbiologic waste may be treated on site before it is discarded by autoclaving and subsequently disposed of as a non-hazardous solid waste in accordance with solid waste disposable regulations. So blood and blood products. Nowhere to throw. So here's your biohazard red waste bag. This is actually a great little image. Okay, so blood and blood products as defined in OSHA or in the OSHA bloodborne pathogen standard are serum, plasma, and other components known or suspected to be contaminated with a transmissible agent, and it must be handled carefully. Small amounts of these materials dried on dressings or other disposable items represent an insignificant hazard once they are properly contained because of the absence of a portal of entry and a means of transmission. Bulk blood, blood-tinged suction fluids, excretions, and secretions are considered infectious waste because they may be splashed onto mucous membranes or because the container may break and become a contaminated sharp. So I feel like this is one of those things that may come up on the test, is knowing, okay, well, where do I have to get rid of my waste? And if they give you an example of like a small amount of blood dried on a dressing, would that be considered, um, biohazard waste? Pathology waste. Now, this was another adventure, let me tell you. So I found out that we actually don't hold any of our pathology waste here in our facility. We send it off to our larger facility, the the big enchilada downtown, and they have an entire pathology room where they keep all of these specimens for a certain amount of time until it's their time to be disposed. And yeah, I'm actually planning on going out and doing a visit so I can get a better understanding of how pathology gets rid of their waste. So this whole chapter has really inspired me to get to know waste management better at my hospital. And that's what I that's what I love about this field and this job. Is just we get to learn so much and um, just explore all the time. So, pathology waste includes human tissue and body parts that are collected at autopsy or during surgery. Pathology waste do not usually fit the definition of infectious waste outlined previously. And that's because a lot of these are going to be soaked in alcohol or formaldehyde, and so like it neutralizes everything and seldom contains pathogens. And then incineration or grinding and discharging into a sanitary sewer are the common acceptable methods of treating this waste. I actually had a really great conversation with Eric about pathology and um, the differences between like incineration and autoclaving, and he was really explaining to me about how dangerous it can be and specifically why will not autoclave anything that has been in formaldehyde, because it can actually be very, very, very damaging um, and very dangerous to employees, and so that's why it has to be incinerated. And he was talking to me about the temperatures. I already forgot about the temperatures, but yeah, just just fascinating stuff. So, waste regulated regulation and guidance. So, waste related regulation and guidance. So, who is telling us how we get rid of this waste or what we need to know? This is something that they love to do. Okay. On the test, they love to ask you, and it could be waste, or it could be um, sterilization, or it could be environmental cleaning. They want to know what agencies are responsible, and they want you to know the difference between like a regulatory agency versus an agency that's just providing you recommendations. Okay. Um, so with that being said, on the United States federal level, several agencies have published regulations and guidance pertaining to infectious, medical, or regulated waste. OSHA and the U.S. Department of Transportation have such regulations. In addition, both the CDC and the EPA, the Environmental Protection Agency, have issued guidance documents pertaining to medical waste management. This is important. You have to know your agencies, okay? You have to know your agencies. I don't know how you're going to remember them, but work on it. Waste management plans. So the efficient waste management plan includes definitions of infectious and non-infectious waste and addresses every step from acquiring materials that become waste to generation of waste, discarding, collection and containment, handling, accumulation and storage, transportation, treatment, and ultimate disposal. The key to success is a collaborative effort, including the IP's involvement. This written plan should include provisions for the assignment of responsibility and authority for overseeing the program to an individual who is knowledgeable regarding infectious disease transmission and who is familiar with applicable federal, state, and local regulations. So for example, the facility safety officer or environmental services director, or less commonly an infection preventionist. And this is the thing. This is the thing. I was talking to one of my team members, and I was like, oh, I really um, I really admire, diversity within teams, like people who bring different skill sets, people who have different um, knowledge, people who can really contribute to infection prevention, to see it from a different perspective, if that makes sense. Like, you come in and you're looking at it through, right, if your background is epi, you're looking at it through an epi lens, or if your background is nursing, you're looking at it through a nursing lens. And all of these different lenses provide such a great picture of just how massive infection prevention is. And one of the things that I really recommend that you do is you have to know these people and these partners within your facility before there are problems or before there's an issue. So who is your EVS director? Who's your patient safety officer? Who's your safety specialist? Who are the people that you can go to and that you can have conversations with? Because let me tell you something, I had conversations about all of this stuff. I called my EVS director. I was asking him about the waste manifest. I was asking him about the labels. I mean, just everything. I spoke to Eric. I spoke to Tara. I went out there. I was like asking questions, trying to understand and get a better idea of exactly how waste management works in our facility, because if something does happen and you need that level of expertise, those connections, those relationships should already be in place to where they know, oh, it's infection prevention, they're trying to help, and you want to understand where they're coming from so that you can give the best recommendations possible. Okay, so objectives for the waste management plan: rendering infectious waste safe for disposal, ensuring that there is minimal risk to patients, healthcare personnel, visitors, and the community from exposure to pathogenic organisms associated with waste generated in the healthcare facility. Meeting or exceeding all federal, state, and local regulations. That's another important thing that they mention in the text, is that you've got different regulations, some states that are a bit more stringent than others. And so it's important to be familiar with that. Eric was telling me about, he's like, yeah, well, I've been on some visits from the Department of Health, and they've been very, they've been very understanding, very polite. He was like, but I have had some colleagues where they've had visits like from the EPA, and they'll just show up and they'll be like, do you have X, Y, and Z? And if it's not readily available, like if it takes you too long to find X, Y, or Z, he said one of the EPA people was like, you don't have this key document readily available because it's taking you X amount of time to find it and to print it out in X, Y, and Z, you're being cited. So I was like, oh my gosh, the drama. So yes, meeting or exceeding all federal, state, and local regulations. Educating healthcare personnel regarding the management plan and the real versus the perceived risk associated with infectious waste. Several studies have shown the importance of adequate resources and staff education in the implementation of an effective medical waste management program. The other components of an infectious waste management plan include designation, segregation, packaging, storage, transport, treatment or disposal, contingency planning, and staff training. One of the things that I did want to pull up, because they mentioned this in the text and I didn't really include it in the slides, but it was a background on the regulated medical waste. And I'm just going to go over it because I think that this is really important. They also mention it on the chapter. So this is under CDC, and it's going to be background, and it's regulated medical waste and EPI. So no epidemiologic evidence suggests that most of the solid or liquid waste from hospitals, other healthcare facilities, or clinical research laboratories is any more infective than residential waste. Several studies have compared the microbial load and the diversity of microorganisms in residential waste and waste obtained from a variety of healthcare settings. Although hospital waste had a greater number of different bacterial species compared with residential waste, waste from residences were more heavily contaminated. Moreover, no epidemiologic evidence suggests that traditional waste disposal practices of healthcare facilities have caused disease in either the healthcare setting or the general community. Then they go in a little bit about how sharps are excluded, but they do mention this in the text where they talk about that comparison between waste that's produced by the hospitals versus waste that's produced at home, because I do think that people are very like hyper aware of waste in the hospitals, and I found that interesting. Okay, next slide. So designation. Once a facility has developed definitions for infectious and non-infectious waste, its policies and procedures for sorting the discarded materials into the proper waste stream must be aligned with regulatory and safety requirements. It is recommended that a list of infectious waste generated in the facility be developed and that the generating areas be identified in the management plan. So true or false, infectious waste disposal is significantly more expensive than non-infectious solid waste disposal. True or false? Very good. That is true. All right, segregation. So individuals who are knowledgeable about the waste origin and its hazard potential must segregate infectious waste at the point of origin. And um, this is touching on laundry, but because this is how my brain works. But one of the things that when I visited our laundry facility, one of the things that they really talked about was the importance of ensuring that items are sorted appropriately um, before they get sent places or back to the laundry, because if items are not sorted appropriately, it can actually end up damaging the machines and causing issues. Like, for example, if you have your linens, but they have disposable diapers in there, or the plastic slash paper Chex pads are in there, that can damage their machines. So when I was reading this chapter, it reminded me a lot of that process, because they really talk about how important it is to make sure that your staff are knowledgeable on those segregation practices and what should go into what bin um, for safety purposes. And also financial reasons as well, because if you just put everything in a red bag, that's going to drive your cost of waste super high. I mean, our costs and spending for waste disposal and waste management in healthcare facilities are in the millions, like the millions. It is that serious. Okay, it's expensive. The waste should then be placed into appropriate designated leak-proof containers, and then Figure 2 demonstrates a process for appropriate waste segregation to minimize the volume of infectious waste generated. So you have that new or reused product used in a procedure. That waste is generated from the medical procedure. Here's where we hit our point of segregation, where it's going to be municipal solid waste, recyclable and a reusable material, or infectious waste, which then gets divided into either bulk liquids, sharps, or solid waste. Okay, so that segregation piece it's very, very important. All right, so true or false? Needles must always be recapped, bent, or broken by hand before being discarded. That's a good one. Yeah, that's false. Everybody was like, false. Of course. Yes, do not. It's that what they actually said was needles must never be recapped, bent, or broken by hand before being discarded. All right, next one. Infectious waste with multiple hazards. For example, used sharps from patient receiving chemotherapy must be segregated as necessary for the management and treatment of the waste characteristic with the most stringent handling requirements. True or false? Very good. It is true. Next one. OSHA and CDC specify that sharps be placed in rigid puncture-proof containers. Yeah, these trues are coming in hot. Very good. And the very last one. OSHA requires either red color coding or use of the universal biohazard symbol and term biohazard. Is that true or false? True, very good. Okay, packaging. We're moving on to packaging. Infectious waste must be packaged properly to protect patients, healthcare personnel, visitors, and the public from potential exposure to infectious materials, and to facilitate the proper handling, storage, treatment, or disposal of the waste. Selection of the packaging must be appropriate for the type of waste being contained to maintain the integrity of the packaging during collection, transport, storage, and disposal. Packaging used for shipment will often contain additional markings and be labeled to comply with application shipping regulations, such as orientation arrows on Sharps containers. And then Sharps containers must be impervious, rigid, puncture resistant, leak proof on the sides and bottom, and closable. All right, storage is very short. Infectious waste should be treated and disposed of as soon as possible after generation. Although there is no published national standard for how long infectious waste may be stored, some states may have limits on storage time at the generating facility. Um, it wasn't that portion of the chapter really wasn't super long, probably because there's not a lot of people storing infectious waste. So transport. The internal and external systems used for the transportation of infectious waste must maintain the integrity of the packaging and protect handlers. Commercial or private vehicles that are employed in the transport of infectious waste should be leak-proof and identified in accordance with municipal, state, and federal regulations. So, IPs should be aware of regulatory requirements and provide input into relevant key operational services. For example, a facility's clinical laboratory courier, who often pick up not only specimens but also infectious waste from affiliated physician practices and other ambulatory care facilities, commonly provide transport of infectious waste. In general, states require the registration of vehicles used in the transportation of infectious waste. A waste manifest documenting the shipment information must accompany that transported waste. And a waste manifest serves as a document that tracks the waste from the generating facility until its final disposition, and it acts as a record of the waste's movement. So you already know me. I couldn't read about this waste manifest thingy situation and not find out where my waste manifests were. So if we learn a little bit more, I will tell you all about where the waste manifests are in my facility because I found out. The waste manifest also acts as a legal document whereby the generator certifies that the waste has been correctly classified, packaged, marked, and labeled according to applicable shipping regulations. The Department of Transportation considers the individual signing the waste manifest to be a hazardous materials employee, and thus the employer is required under Title 49 of the Code of Federal Regulations to train that individual. Having the waste manifest signed by an untrained employee can result in significant penalties, and copies of waste manifests must be retained for a minimum of 3 years under DOT regulations, and states may require longer retention times. So you have these in your hospital. I don't know who has it at your hospital, but I'll tell you who has it at mine. It's facilities. They showed me the waste manifest books that they have upstairs, and they have like years of records. Let me tell you something. Our waste is going all the way out. Okay, I'm out of Florida to Chicago, to Ohio, to Indiana. Like, when I tell you, I was not prepared. I was not prepared. I just didn't know that our shenanigans and our garbage made it like that it had to be. Now I understand why it's millions and millions and millions. Just the drive alone. Like, when you really sit down and you think about it, it is wild. It is wild. I was looking over the manifest, and Tara was like, "Oh yeah, it has to go so far. It's so expensive." Like, she was walking me through the whole process. She was like, "I keep these records for X, Y, and Z." She was sho- I was she was showing me the actual manifest and kind of showing me like, "Oh, you see this, like this SD4 or S whatever." She's like, this is referring to different types of categories. Every type of waste has a designation. You have to specify the quantity. It was, yeah, it was really cool to learn about all of this. I'm not gonna lie. I mean, I love learning. Okay, so treatment. Hospitals traditionally selected incineration as the primary method for treating infectious waste, but its use has declined due to EPA regulations related to the Clean Air Act and control of emissions. Depending on the type of infectious waste, acceptable methods for rendering these materials innocuous include steam sterilization, chemical disinfection, gas vapor sterilization, and irradiation decontamination. Modern alternative technologies have broadened the scope of available treatment options. Microwave, infrared, thermal plasma, and hyperchlorination are only a few of the new technologies being used to render infectious waste innocuous. And then this is from the EPA. website, which talks about commercial and industrial solid waste incineration units. And this is what they had to say about it. Section 129 of the Clean Air Act directs the administrator to develop regulations under Section 111 of the Act limiting emissions of 9 air pollutants. That is particulate matter, carbon monoxide, dioxins, furans, sulfur dioxide, nitrogen oxides, hydrogen chloride, lead, mercury, and cadmium from 4 categories of solid waste incineration units, which are municipal solid waste, hospital, medical, and infectious solid waste, commercial and industrial solid waste, and other solid waste. So much to know. I know, it's crazy. So disposal, the direct disposal of infectious waste at a properly sited landfill does not present a threat to public health and safety, according to many experts, and is still acceptable in many areas. After treatment, medical waste are usually disposed of in a sanitary landfill that is specifically designed to protect the environment from releases. Municipal waste sites, or landfills, will often evaluate waste to ensure it is acceptable for disposal. If medical waste is inappropriately disposed of in a municipal waste site, the generator of the waste can be fined for regulatory non-compliance. So waste management training. One of the things was when we go back to this waste manifest, it says that the DOT, you have to, this stuff is signed off. So it's signed off by the person who picks it up and it's signed off by the person who's sending it off. And it tells you that the individual has to be trained. So while I was doing my investigations today and throughout the week, what I found out was that that we actually have a training and our facility requires for it to be done annually, and it's the safety manifest training. So you probably have other if you're a larger health system or just in general, if you're if you're at a facility, you have these trainings that your team members are doing to know how to deal with this stuff. Okay, so waste management training. Training of all personnel involved in the generation, handling, transporting, treatment, or disposal of infectious waste is imperative for the infectious waste management plan to be effective. Trainings should include the definition of infectious waste, handling procedures, appropriate personal protective equipment, hand hygiene, labeling or coding that designates an item as infectious waste, and post-exposure management. So, true or false, regulatory agencies such as OSHA and the Department of Transportation require specific training for some personnel. I kind of just gave you that answer because I was look, I was not expecting to be this enthralled by waste management. I was personally not prepared. So I hope that you guys are enjoying it because let me tell you something. It was quite a bit to learn about. Okay, let me see where we are with time. Okay, I got to speed it up. So waste management and infection prevention and control implications. So when developing or revising a healthcare waste management plan, IPs and their colleagues should consider the following noteworthy points. The items used in the care of hospitalized patients can generate up to 25 pounds of hospital waste per day, which averages to almost 7,000 tons of daily waste by hospitals. About 10 to 15% of the total hospital waste by weight is considered infectious waste. The cost of disposing of infectious waste is up to 10 times greater than that for disposal of non-infectious hospital waste, and up to 30 times more than recycling, adding 10 billion in annual disposal costs to healthcare. 10 billion. Do you know what I could do with a billion? Do you know how many doggy shelters I could help? How many scholarships I could start? Oh my goodness. It is crazy. Yeah, the money aspect of this waste management stuff is wild. With the exception of sharps such as needles, which have caused disease only in an occupational setting, there is no scientific evidence that medical waste has caused disease in hospital or community settings. Household waste contains on average 100 times as many human pathogens as medical waste. And that was similar to remember what we were reading, that the CDC had said? So waste reduction, including reuse and recycling. IPs may be asked to help evaluate reusable items to replace single-use disposable items to reduce waste volume. Reusable containers for regulated medical waste and sharps disposal boxes are one such effort that has gained popularity with the increased emphasis on environmental stewardship. So, ooh, Pogorzelska and Maziars, I am so sorry if I apologize, published a study comparing rates of C. diff infections between hospitals that had single-use sharps containers versus those using recyclable sharps containers. In that study, hospitals using single-use sharps containers had a significantly lower rate of C. diff infection compared to those that had reusable sharps containers. Neely and Associates compared single-use sharps containers with reusable sharps containers to determine levels of contamination for various microbes. This study found that there was less contamination on single-use containers and that those microbes identified on containers have the potential to cause harm among patients who may be immunocompromised. Now, while this is telling you essentially like, hey, perhaps you should consider, single-use sharps containers. They really emphasize that it's important to do a risk assessment because there is evidence that reusable sharps containers can dramatically lower the incidence of sharps injuries to healthcare personnel during the disposal of contaminated sharps. So single use, okay, not as many pathogens, but reusable sharps containers are safer essentially. And so they really talk, before you make those decisions, and if you're as an infection preventionist involved in this, then to make sure that you're thinking about all of these things. Pipe systems waste. So vacuum and suction systems are part of medical gas systems and should not be overlooked in a waste management program. Laser plume and surgical smoke may be evacuated into the wall suction system in some locations. Analysis of surgical smoke and aerosols has found the presence of viable organisms, including bacteria and viruses, in addition to numerous potentially hazardous chemicals. Patient to patient and patient to provider transmission of human papillomavirus has been reported during a laser procedure. Okay. And more recently, laser plume has been shown to be of potential concern for infection with SARS-CoV-2. So good old COVID-19. Use of wall suction, even with inline filtration, is only suitable for minimal amounts of plume. A smoke evacuator system with appropriate filtration systems is preferred. In both situations, the inline filters from wall suction and plume capture equipment should be treated and discarded as potentially infectious waste. So this is all obviously, very important for all of our IPs that are constantly out in surgery. Okay, so we're gonna skip it's 2:49. I'm gonna do Ebola real quick and then um, we will do questions. Okay, so Ebola infectious waste. Sorry, I had to skip a couple slides because we're almost out of time. The 2014-2016 Ebola outbreak in West Africa was the first to result in Ebola transmission in the United States, and the treatment of Ebola patients resulted in significant waste management challenges for U.S. hospitals that provided care. Medical treatment of patients infected with, sorry, I lost my place. Where was I? Medical treatment of patients infected with Category A infectious agents produce a larger volume of waste. A single Ebola patient generates about 440 gallons, 440 gallons of waste each day. To accommodate increased transportation volumes of Ebola waste, the Department of Transportation issued special permits to allow the use of alternative packaging. This practice eased waste management limitations and aided in a timely waste destruction. This is really important because this is not the kind of, you don't want to necessarily be caught off guard when it comes to Category A agents. And one of the issues that happened in the Ebola response was that one of the incinerators in Louisiana refused to accept the Ebola waste from the hospital in Dallas. And so it wasn't until the University of Texas medical branch agreed to accept that waste that they were able to do what they needed to do. But one of the big things is that the healthcare personnel really felt like they had not been trained properly. They they really felt that, okay, we have an Ebola patient, but they were afraid. They lacked preparedness. They felt like they didn't receive appropriate training to handle Category A waste. They were, I mean, 440 gallons. Come on, like it I mean, just think about that and having to deal with that from one patient. Um, and so it's important. It's important to have, like I said, those relationships so that if something does happen, you're able to, you're able to do your best. Okay, we're gonna go ahead and go straight to the questions. All right, so question 1. Which of the following is an example of infectious waste? An unused syringe and needle that were discarded after accidentally being dropped on the floor, a gauze pad with a small amount of blood on it, gloves that were worn to administer a Hep B vaccine, agar plates used for testing sputum samples in the microbiology lab. Okay, let me see. Agar plates used for testing sputum samples in the microbiology lab. And here's our rationale. Any object with the potential to have sufficient dose of a pathogen, a portal of entry, and a method of being transmitted are considered to be infectious waste. Bacterial cultures that have amplified potential pathogens may also have sharp edges and should be considered infectious waste. Non-penetrating objects with minimal blood and body fluid contamination are not infectious waste, and unused sharps are not infectious waste but must be disposed of in a sharps container because of the high risk of puncture injuries and inability to know that the object was not contaminated. Another thing, go to your emergency department. Since we're having this discussion right here about waste, talk to your emergency department about how they're getting rid of their single use like suture removal kits, and if they're disposing of them appropriately, number one. Number two, your your equipment that needs to be sterilized. So if they have to do like they have this, if they have a small biopsy tray that they get from SPD or other types of equipment that they get from SPD, what their process is for getting that back to um, the sterile processing department. Just go ask some questions. Okay, question 2. Which federal agencies in the United States have published regulations pertaining to infection and medical or regulated waste? Okay, you guys are doing good. You guys are doing good. You're killing it on a Friday. 10 out of 10. Everybody put C. Not a single different answer. So, on the federal level in the United States, several agencies have published regulations pertaining to infectious, medical, or regulated waste. The US EPA, OSHA, and Department of Transportation have such regulations. In addition, both the CDC and EPA have issued guidance documents pertaining to medical waste management at the request of the US Congress. The Agency for Toxic Substances and Disease Registry prepared and published a comprehensive review of the public health implications of medical waste. All right, question 3. Exposure to contaminated healthcare waste does not necessarily result in infection. The following factors must be present for contaminated waste to be capable of causing infection. 1. Dose and host susceptibility. 2. Portal of entry. 3. Portal of exit. 4. Presence and virulence of a pathogen. Oh, very good. Very good. The majority of you got B. Okay, you guys are doing great. So pathogenic organisms are found in many different day-to-day settings: not garage, sorry, household garbage, bed linens, soiled diapers, and unwashed hands are all examples of environments in which pathogens can be found routinely. A number of studies have shown that though hospital waste can have a greater variety of organisms than residential waste, those from households are more heavily contaminated. For waste to be capable of causing infection, the following specific factors are necessary. 1. Dose. 2. Host susceptibility. 3. Presence of a pathogen. 4. Virulence of a pathogen. And 5. Portal of entry. All 5 of these factors must be present for infection to occur from waste. And our last question. Which of the following would be considered biomedical waste? A. Diaper soiled with feces. B. Blood tinged suction fluids. C. A wound dressing that is not saturated. Or D. Isolation gown worn to deliver a food tray. So blood tinge suction fluids. All right, so blood and blood products as defined in the OSHA bloodborne pathogen standard must be handled carefully. Small amounts of these materials dried on dressings or other disposable items represent an insignificant hazard once they are properly contained because of the absence of a portal of entry and a means of transmission. Bulk blood, blood tinge, suction fluids, excretions, and secretions are considered infectious waste because they may be splashed onto mucous membranes or the container may break and become a contaminated sharp. Okay, and very last thing for week 12, you've got cleaning, disinfection, and sterilization, and this information here. That's all I have for today, everyone. Thank you so much. Enjoy your weekend. And good luck, Allison. You're going to do great.